promote these kits.
Is it the right approach? Is it the right approach to judge the gravity of the pandemic?
Reported cases
of positive tests,
more than 55% increase in cases,
of 732 cases,
high case count,
reported more than 500 cases,
Omicron cases,
the number of daily cases.
Of those cases,
if we have more cases,
updated case reporting,
803 cases,
55% increase in cases.
The surge in cases.
Doctor, thank you very much for joining. Every day we hear that there are rising number of cases. Cases has become like a terror ward. How serious is it actually?
From the very beginning of the pandemic, the case definition in this pandemic is something which was never same for any other previous disease. In public health history, we never defined a case by a lab test, because it is well known that a large number of people are harboring a lot of viruses, bacteria, other things in their throat, in their gut, on their skin. We are carrying almost 2 kgs of viruses and pathogens. And if the virus or the pathogen is causing symptoms, then it is a disease. So by traditional definition, by conventional definition of a case, the symptoms used to come, the person used to go to a doctor, the doctor would have prescribed a test. And then basis of the clinical symptoms, it is correlated with the test results, then only the person is labeled a case of something. In this, paradoxically, in this particular pandemic from the beginning, the case definition has been changed by whatever international bodies, including the WHO, that anybody, and the diagnostic test itself had raised many questions among the experts also. The RT-PCR. The RT-PCR is a research tool. It is a tool of process to identify. This has been used as a diagnostic test, which is very sensitive. Even it picks up broken particles, dead particles. Person is not having symptoms. The virus must have just come and gone, but left some remnants. And that is also picked up. And by increasing the cycles, it is labeled a case. The person may be totally asymptomatic. So this was one thing. So and a second thing was this raised the panic level. Out of this, so many people labeled as cases with positive RT-PCR, almost 90% were asymptomatic. Only 5% or 10% required any hospitalization. But the case definition, 80-90% also got psychologically, they also started having some psychological symptoms, and they also went to the hospital, and the hospitals were only too happy to accommodate those because their beds are full, because other cases are not coming to hospital, and they were billed accordingly, because most of the, particularly the United States and India also, we are now following the corporate model of healthcare, where private hospital and insurance companies were only too happy to accommodate such cases which are labeled as cases, but which was not as per the earlier traditional way of labeling a case. That was one thing. Second thing, what happened was this labs got mushroomed. Initially, there were only few labs, which is a highly specialized test. This RT-PCR is a highly specialized test, and only few labs could do it.
We have 2,441 positive COVID-19 labs that are awaiting review.
It became a good year, investment for people making these test kits. So it just mushroomed. To that extent, everywhere they are, every lab has started doing RT-PCR. And it increased the cases, because after some times the virus is harbored by many people, but only few suffer. But if you label everyone with a positive test, the case numbers can cause panic.
High case count,
reported more than 500 cases,
Omicron cases,
the number of daily cases.
Of those cases,
if we have more cases,
updated case reporting,
803 cases,
increase in cases.
The surge in cases.
This was the first thing, was the definition of a case. which was distorted in this pandemic. Second distortion was the definition of cause of death, the attribution of cause of death. Because cause of death can be, we die every day, large number of people die to various causes, comorbidities. And that person is dying with a number of pathogens in the body. If you take out one isolated pathogen and you would not label that as a cause of death. You are carrying tuberculosis pathogen, you may carry typhoid bacilli, you may carry pneumococcal, you may carry streptococcus. Person is always a full of bag of germs, but they are almost existing in symbiosis with the human host. And person may die, does not die of one cause, it dies of other causes, old age with comorbidities. And if you can pick up any year, you can give a inflated death rates. That is what happened in the initial pandemic when it hit Italy. After China, it hit Thailand. There was hardly any deaths there because the Asian population, the younger population, they are not very obese. Then when it hit Europe, that is Italy, it ran through the nursing homes. The average age of death was 80 years. And every person, every winter or every seasonal, when there is a flu season, large number of elderly die of viral infection, be it a common cold virus or an influenza virus, and this time it happened to be a coronavirus. And if you start testing and labeling this as a cause of death,
sorry for interrupting. So what you are saying that it has never been in the history that only the number of cases was getting noticed or is coming on the media.
It was number of positive tests. See, this time they put the cart before the horse. First, the patient should have symptoms. Patient goes to the doctor. Doctor orders a test and correlates with the clinical sign symptom. In fact, if you see the small print, even if you see RT-PCR lab report, in the small print it is written that this test does not mean you have to correlate with clinical symptom. But nobody is reading that. Anyone who has got a positive test is labeled as a case of COVID-19, which is against even the guidelines of the kit. Kit says you have to correlate because in the fine print they are not making this mistake, but the way it has been handled by the World Health authorities or World Administrative authorities, that anybody with a positive test is a case. And anybody dying with a positive test, is labeled as a COVID-19 death.
Despite having other
complications. There have been instances in USA, if you do just a Google search, a person has got a gunshot wound, goes to hospital, RT-PCR positive, he dies of gunshot wound and his cause of death is COVID-19.
After a man named Robert Hart sustained serious gunshot injuries outside a Newland motel last week, and he died despite first aid attempts. Now, since his death, health authorities say he tested positive for COVID-19, and One News understands that several people are also isolating. So then you have to ask how someone who sustained these types of injuries and then died ends up as part of our COVID-19 death tally.
Or anybody dying with a positive test due to other causes. People have died of traffic accidents and RT-PCR, they have been labeled like that. There were other incentives also, that any hospital admitting a COVID case used to get some extra grant from the government. Similarly, anybody put on a ventilator on COVID used to get extra. So there was an indirect incentive. Even in our country also, they have given some ex gratia payment of people who die of COVID. So there are a lot of other influences which has.
Can you please elaborate on this, Doctor, a little bit? I mean, how the doctors were given this kind of orders to show the inflated numbers.
They were not, even without giving the direct, they were given the incentives. The hospital had the incentive that if you admit so many COVID, and then as I said, indirectly also, like even in our country, all the private hospitals were taken up by the administrative authorities. And out of fear, the bed occupancy of the other day-to-day cases, other comorbidities, people were not coming to the hospital. The hospital were facing heavy losses. So they had to admit the mild cases or asymptomatic cases to inflate the bills. Then they were getting grants for this from the government. for treating the COVID patients. So naturally, that was whether you tell them or not to survive, they had to do it that way. And of course, the way that this was projected that it's a pandemic, they are doing a great service and all that to check the pandemic. It did not check the pandemic. In fact, people who went to the hospitals, probably, I think after some time, the hospital became a source of infection because all people at one place, perhaps traditionally, if it has been treated in a traditional manner, people recovering in their homes would have spread less infection. Other fact, cases are increasing because, as I said, the number of kits has increased. Everybody is selling the kit. And now they are having the home kit. You can buy a test kit over the counter. After the Omicron has come, you can buy the test kit, and if you are positive, you are supposed to upload it in the website of ICMR. So that will increase the cases. I mean, now, though on one hand saying asymptomatic will not be tested, but you are encouraging people to test themselves. So this a lot of commercial kits have come, which is again to promote these kits.
Is it the right approach? Is it the right approach to judge the gravity of the pandemic?
Certainly not. Certainly not. In fact, I would go one step further, and it is not me only. There is a site called Evidence Medicine. Firstly, they have distorted the definition of case. Secondly, they distorted the certification of death. And it is very difficult to understand why they have made an exception for one disease in defining a case. The person doesn't have to go to the doctor. The technician does the test. And
why, doctor, why this approach? Is it just to create fear mongering? Is it intended? What is the agenda behind?
I think agenda is a mixed agenda. I mean, a lot of people have got the different dynamics. There may be some people may be fear mongering, other people must be genuinely fearing, even including the medical community. Most of them are under fear, under panic. Doctors also, nurses also thinking that this is something a very lethal disease, which it has not really. The statistics do not show it. In healthy medical students or healthy young person, up to the age of even 69 years, the mortality is less than 0.5%. So all the other communicable diseases in our country has got much higher mortality. So the data never supported such draconian measures. Of course, initially one could have been careful, but after the first 3-4 months only, after the, let us say, by the March, the December, the pandemic started by April or May, there were published studies by JN.1 It, by Jay Bhattacharya from Stanford Universities, who refined the case fatality rate. Initial case fatality rate was calculated when they made the models and other things from Italy, and they calculated the case fatality rate from hospital admitted cases, which are the serious cases, which are not representative. In fact, one paper in Lancet said the mortality rate can be as high as 20%. So naturally, the world got scared. There was panic, and they projected the models throughout the world, and those models were projected. Even today, they are projecting the models from the Western countries to the Asian countries, which are faulty inputs. Subsequently, JN.1 It, Jay Bhattacharya from Stanford, they published a paper where they did the sero survey. They found the infection has already spread far larger. In our country also, when we did a sero survey, we found 90 crores people in June have already got the infection, but the reported cases were just 5 crores or 3 crores. So we were hardly catching 5% of the cases, which are the denominator. But once you include the cases which are spread in the community by sero survey, the infection fatality rate in the Western countries got refined to 0.3% across all age groups. Even in the CDC and WHO site, infection fatality is 0.3%. In our country, because we have got a younger population, it is 0.05% or 0.08% as extrapolated from the sero survey. So this should have been reassuring, but somehow it is still projected a very lethal disease. And even when we have got Omicron now, where every household has got Omicron, it's milder than the common cold also.
So, but we are not publishing the number of deaths. No, every day we are not publishing the number.
Deaths. So what is happening? Deaths are very low. Deaths, like if I say in my district where I am monitoring the air, like there are just 2 deaths, 3 deaths, or 5 deaths in a day. But if it becomes 10 deaths in a day, immediately it is inflated that it has doubled. If it is 2 deaths for 3-4 days, suddenly it becomes 6 deaths. That is nothing actually. In a large population, from 2 deaths it becomes 6 deaths, they say it has tripled. Death rate has tripled, and the headlines people see the triple. They don't see it from 2 to 6. And out of this 2 to 6, also many people may be having other comorbidities.
So everything is in the number game.
Number game, you see, this is what statistics, we call it statistics. Actually, if you see the history of statistics, why you call it statistics? Historically, it started as a state, S-T-A-T, state, stat, weapon of the state. So it was used by to control the people. That is why the name statistics was given. So the statistics have gone back to its traditional role. I mean, I just see the history of statistics. So they say, somebody said, no, I think Disraeli, he said there are lies, damn lies, and statistics. There are 3 types of lies. I think it was Disraeli of, I think UK, he said, there are lies, damn lies, and statistics. So it was a power of the state. From the state, the term statistics have evolved. So it is not science, it is politics.